People, welcome back to our safe haven. If you don't already know, my name is Belle, but you can call me Belle. And here on this channel, I just want to inspire you by sharing my life journey and how I balance my lifestyle through faith, fashion, wellness, beauty, and more. If you're interested in all of these things and interested in leveling up with me and getting on this wellness journey, for all of my new subbies, you are so welcome here. This is a safe space where we learn about each other, we grow together, and we just be on this journey that we're on, trying to get better and balancing everything that goes on in our lives, right? So if you're interested in this channel and all of the things that I have to share with you guys, don't forget to subscribe, put on your notification bell so that you can get notified when I do have another video out. But thank you so much for your support this far. Now, without further ado, let's get to the video. We see by the title that I had a major kind of like minor surgery. That's why I've been missing for 2 months. But anyway, I am back here and I wanted to take the time to kind of like relax and make sure that I was getting better, that I was resting before I come on here and start blurring. I don't know what I'm saying, but before I start going on a rant off about what actually happened. So I'm going to break down this video in 3 parts. This first part will basically focus on how I discovered that I had a uterine fibroid, what it is, and how I went about removing it. And I will also put another video about my hospital stay before surgery, after surgery, and how I've been recovering so far. So if you're interested in this journey, I'm gonna be posting probably every other 2 days. I'm not sure yet, but I'm gonna try to make sure that this first video come out so that you can have access to it, and hopefully I have the other videos every other week that comes after that. Finger crossed. But anyway, guys, the reason why I decided to do this video is because at first I realized, I'm very private. I don't like to share too much in terms of like my personal, like private things. Like I don't like to share my health conditions or things like that. Sometimes I try to like stay away from putting too much information out. But this one I really wanted to share because I was encouraged by so many women right now that I'm seeing we're doing better on social media that have been sharing their journeys with their uterine fibroids and how they removed it. And before my surgery, I was more at peace after watching those women talk about their journeys, and I felt like, you know what, maybe me putting this out will also help someone else too. And that's why I decided that I'm going to make this video, because I realized that this subject is something that is not really talked much about, especially in our community in terms of like people that look like me. But I decided, to bring more awareness towards that subject, and this is the reason why I feel like it's necessary for me to kind of talk more about what it is that a uterine fibroid is and how we can get checked so that we can make sure that we are taking care of ourselves. And I know here in America, we do know the statistics and how, women of color or in that community is not well taken care of when it comes to the healthcare system. We are kind of like put off when we kind of mention our concerns to providers. But I think that at the end of the day, you are supposed to advocate for yourself. So making sure that you're taking care of your health is all overall necessary, not just the financial aspect of your life, not just the spiritual aspect of your life, but your physical aspect of your life is as important as any of those things as well. And so you should advocate for yourself and make sure that you get the best care that you deserve whenever you're discovering new things about your health. So what is a uterine fibroid? It's basically a non-cancerous growth, I should say a benign tumor that is developed in the muscular tissue of the uterus. And it is very common that this condition affects many women, especially in the reproductive age, but we do see them predominantly in the Black community, or I should say in women of color, right? And uterine fibroid can also vary in sizes. So they can be as small as a size of a pea to a large grapefruit or even a freaking watermelon, y'all. Like that's kind of close to what mine was, which I probably will show you guys in another video if you guys are interested to even see what that looked like. But yeah, so that is overall what it is. Now, The cause of the uterine fibroid is not necessarily clear yet. We haven't really found out the cause of it, but we do know that it can be based on research that it is related to genetic factors. Like I said, black women have them a lot. I mean, white women have it too, but it's predominantly found in black women. It can be factors like hormones or other factors that can play a role in getting those bad boys. Now, symptoms that are included when you do have a uterine fibroid can be heavy blood flow when you have your menstrual cycles, pelvic pains, you know, like a lot of pain. Depending on the size and the location of the fibroid, it can also affect fertility. So it can stop you from having a baby if you're trying to have a baby. And also, depending on where it is, it can also cause complications during pregnancy, like maybe pressing against organs and all of that stuff, you know. So it is very important to kind of take care of something like that. There are so many different types of treatments, things that you can do to remove your fibroid. Or I should say there are different types of treatment that you can choose in terms of how you want to treat this fibroid. You can either do the medicine, some people take hormones, birth control, which doesn't really shrink the fibroid, but it kind of like helps with the symptoms, like the heavy bleeding, the flow, and some of the pain. You know, and some people take medications to kind of like shrink the fibroid. But with those, sometimes you are kind of at risk to infertility or not being able to be pregnant. If you're somebody that already had babies, you can do that. And then there is the surgical route, which is they're going into anesthesia and kind of like removing the fibroid altogether. Some people, when they have a baby too, I realized a lot of people decide to remove their entire uterus, which was not going to be the case for me. Lord knows I am going to need all of my body parts to stay in my body. Okay, but you know, that is not always the option that you have. Some people may tell you, oh yeah, you might have to remove your uterus, but there are so many other things that you can do without having to remove your uterus. And Lord knows, make sure you do your research before a provider tells you that you need to take off your uterus. Okay, so which is what I did. I did a lot of research and I decided that I wanted to pick the best option for my health. And I'm going to tell you basically a little short story on how I actually found out about this fibroid. Now that you know what it is, I believe October 2021, we went to Chicago for my sister's birthday, and we got into an accident on the day of her birthday. That's a story for another day. After that, we went about our days. You know, we did the things that we needed to do, like we went on with the steps on what we needed to do after the accident. Normally, you know what you do, you go to a chiropractor and whatever, they're gonna check you out, and you do all your treatments to make sure you get that money, that check, whatever. Not true. You need to get treated, especially if your accident is bad. Okay, disclaimer. So I went in there and I saw a chiropractor when I came back around November, and you know, obviously they had to do an MRI done because I had actually a lot of back pain. So upon getting the MRI report, he found out that I had a little benign tumor, which he obviously saw as a fibroid. And he said, hey, you know, it looks like you have a benign tumor, which at the time with the MRI, it showed that it was a 5.5 centimeters little benign tumor. And I was like, oh shoot, really? She's like, yeah, so you might need to get checked for it. You might talk to your PCP to see like what it is that you need to do about that. So what I decided to do was like, okay, I'm gonna go talk to my PCP and maybe she'll kind of like tell me what I needed to do. But before all of this happened, let's rewind. My periods were extremely bad, right? Like I couldn't even stand and do anything because how much pain I was in. You know, like I was in so much pain on my first day, and I honestly thought, man, why do women have to go through this? But I'll see women who doesn't really go through that. And obviously for some people, they will say, well, not every fibroid causes pain, because I know some people who have the fibroids and they don't have pain. But for me, they cause extremely bad pain. But at the time, I didn't even know that's what I had. And what I started noticing over time is that I started getting pressure around my bladder, right? So I felt like, this is weird. Like I'm feeling a little pain, and some days it will be harder. Maybe around the time when I'm ovulating, I think it will feel like it worse. Like it will feel like, oh, this is bad. Like this is, you know, like when you get the symptoms for your period kind of thing, and it would be still bad. Like it would be, and I would tell my husband, oh, I need to get this checked because it's bothering me a lot. So long story short, fast forward, I've been dealing with that pain until the accident, which I then find out that it was a fibroid. So then I went to my PCP, and my PCP decided to do what you called a transvaginal ultrasound to confirm that it was a fibroid, because they're able now to kind of get access inside of the uterus and actually see everything and make sure that, oh, okay, this is what it says this is what that they said, this is the inside, this is what it is. So when she ordered that, we did the transvaginal ultrasound, and fairly enough, it was actually a fibroid. And by then, it appears that my fibroid had already grown. So then when they kind of, sized it, it looks like it was a 7.2 centimeter fibroid. So now it came from a 5.5 to a 7.2. That's in a matter of like a month or two. So now my provider was like, okay, yes, you do have a fibroid. I'm going to refer you out to a gynecologist so that you can kind of sort out your options on what you want to do, because some people can choose to keep those in and some people can choose to remove them. I say if you feel like you have anything that is abnormal in your body, remove them if you have to. Do your best research, and if you feel like it doesn't bother you, you don't have to. If it doesn't bother you a lot, but if you feel like it's really bothering you and it's kind of like bothering your quality of health, they always encourage people to remove them. So as I was going through the process, I was still debating whether or not I wanted to remove it, but I knew that I needed to do something about it. I went to a specialist for uterine fibroid. At the time, there was a clinic that specialized in that, and they offered me so many different options, where there's the hormones and there's this medication, that new medication that they were gonna try, and like kind of like zap the fibroid and kind of like removed it that way. Those are less invasive ways, but the repercussions would have been that it could have prevented me from being pregnant. And disclaimer, although I wasn't really trying to be pregnant at the time, I didn't want to remove that option for me, because obviously, God willing, I want a baby, right? And so I left it at that, and then I went back to another referral. I went back to another guy. So y'all, I did my research, because I was not going to let anybody take care of me, or actually anybody cut me up if I decided back then that I was going to do the surgery. I needed to make sure I did all of my due diligence and figured out who was the best provider for me. And as I did all of my searching, my providers told me that, well, since it's bothering you so much, you have the option of removing it through surgery. Now, there are so many different types of surgery. I'm not going to give you all of the details in this video, because I don't like long videos about things. But I decided, you know what? Finally, I found what the provider told me to make the most sense, which is to remove it, because where my fibroid was, it looks like if I did get pregnant, it was outside of the uterus, thank God, because it could be different places. It could be inside or outside, and mine was on the outside of my uterus. So I was like, you know what? I'm gonna go through with this, right? Because she told me that during my pregnancy, it could have bothered me even more, and it could have been more complicated. It could cause some complications. So based on the information, she wanted me to give me a lot of information so that I can make a sound decision. So then I actually went on and back to my PCP, and I was like, you know what, I want to do this. And she was like, you know what, I have the best surgeon for you. And she referred me out to one of the best surgeons that I think in the South Lake area. And his name is Dr. Ravi Gada. He's amazing. He's great. He's basically, I think, one of the best, because he basically does those surgeries every Fridays, and he called them Fibroid Fridays, because that's how much of them he gets done. So I decided that I wanted to do that. And fair enough, months went by, and I had to make an appointment, obviously, for my first pre-op appointment. I also went to do another ultrasound somewhere else to see if my fibroid was growing, which it was. So as the fibroid started to grow, I realized, okay, you know what? Maybe it is time, like, I need to set up my surgery. Finally, it appears that this was going to be my decision to actually move forward with the surgery. So I went on to the first appointment, and my fibroid was already at a 7.9 or something, or 7.10. I don't remember, but it was growing. And so I needed to kind of like make up my mind that I was going to get it done. So I'm going to head with you to the next video so that you can know which procedure that I decided to undergo. So there's two options that I could have went with in terms of the surgeries. There's the myomectomy, open myomectomy, and the laparoscopic option. So the laparoscopic option is basically a minimal invasive procedure where they have several small incisions to the abdominal wall, and they will insert the laparoscope. Laparoscope basically is a little small lighted instrument so that that has a camera in it, so that they can kind of see and visualize the abdomen and what's inside of it. And they will also insert those surgical instruments so that they can remove the fibroid. So they will insert it through those small little incisions. I think they could do like 2 or 3, 4 incisions on your abdomen. They're really tiny, and they kind of like go in, and they will basically blow up your belly so that they can remove it. And then there is the open myomectomy, and with the laparoscopic option, you would have a shorter stay and a faster recovery. So you will only be in the hospital for 1 day, and after your surgery you probably will be good to go, and the recovery time is probably about 4 weeks, I believe, or up to a month. And then with the open myomectomy, it is basically 6 weeks of recovery and 1 hospital stay. So next to the video, I'm going to tell you, based on all of my research, which one I decided to do. Down in the comment below, let me know which one you think I went with, if it's the laparoscopic or the open myomectomy, because a lot of people have different options and have different opinions about this. So I want to know, like, which one you think I did, and which one do you feel like other people usually do. But I feel like a lot of people, you know what, I'm gonna end this right there so that you can go to the next video. All right, guys, I'll see you guys in the second video of part 2 of which one did I choose to go with and why, and my pre-op and what I did before pre-op. See you later. Don't forget to subscribe, keep your notification bell so that you can know when the next video comes out. Bye. Click on the link for the second video.